As the CEO of CLS Health, which is a physician-owned health care group, Megan Owen is focused on rebuilding trust between providers and patients. She's especially interested in communities that have been historically underserved or overlooked, and she's totally passionate about reshaping healthcare for women and their families. Megan faced the pressure of leadership, juggled life's sudden losses, and found meaning in community. Inside and outside the healthcare world, she knows what it means to be faced with challenges. This episode brings together candid talk about being a caretaker, choosing compassion over burnout, and standing up for yourself as a woman in any room. These are stories of resilience, real conversations about tough decisions, and reminders of why preventive care matters for every family. When you subscribe to our show, you help us grow. Someone you know may need to hear this story. So please share with your family and friends and consider supporting our mission at therose.org. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Megan, thanks so much for being with us today. We're just so honored that you've come to be on this podcast.
Well, thank you for having me. I'm happy to be here.
So you have a long history in healthcare.
I do. Over 2 decades, yes.
Yes, and almost always as a leader, almost always COO, CEO. Mm-hmm. So what in the world convinced you to become CEO of CLS, which is, tell us about it. Tell us how you got there.
Sure.
Yeah.
So I would say probably about 10 years ago, I was actually at HCA Clear Lake with the phenomenal leader who pulled me aside one day and said, "You are the right person, but the wrong role. You need to be in leadership." And I was sort of surprised whenever he said that. Mm-hmm. And he started putting me in different meetings and listening to different other leaders speak. And I thought, this is pretty exciting. Maybe this is the route that I want to take. And over the next few years, he helped mold me. I went back and got my MBA. And then I took a role on the surgery center side of HCA, and then eventually left and went to Houston Eye Associates as their COO. And one of the doctors that were at Bay Area Regional actually recommended me for that position. And I thought, let me, put all of my eggs in one basket and go for it. And I did. And working at Houston Eye Associates was a great learning experience for me because it was a physician-owned practice. Mm-hmm. And after about 5 years there, I actually decided I was going to retire. And yes, I was home for about 6 weeks, and I had a conversation with Dr. Dwake. And he said, "Why don't you come in and talk with me and Dr. Baba? We're looking for a CEO back in Webster, which I'm from the Pearland Friendswood area, so it was kind of exciting to get back into town." And we had about an hour conversation, and I called my husband, and he said, "Is your retirement over?" And I said, "Yes." He goes, "It lasted 6 weeks." And I said, "I know." But after speaking with Dr. Baba and Dr. Dwake about CLS, I knew it was where I needed to be. They have a mission of being in every single community in the Houston area and really living and working in that community and doing what's best for the patients who live there. And it's something that just hit me. They were a party of two when I first met them back in my Clear Lake days at HCA. So I've known them for a long time. But to see how they've grown and what their mission is and to really stay provider-owned, provider and patient-focused, that was it just resonated with me.
So what makes a provider-owned facility different?
It allows them to practice medicine the way they want to practice. And then we take care of everything behind the scenes that really can muddle up healthcare. And the doctors get to focus on the patients. And that is sometimes lost in some of the other types of organizations that are out there. And it's something that Dr. Baba and Dr. Dwake really push is, provider-owned allows them to take care of their patients.
Do you think they have a special focus on women and the needs of women?
I do think that is a very specific focus that we do have. Right now we have a few OB-GYNs, but we're hoping by the year of 2030 to have 200 OB-GYNs across the Houston area. We have a small oncology and plastics department now, but we're looking to grow both of those across the city also. We want to focus on the underserved areas, which is something that I know you all focus on as well, which I think is why we have a good partnership. And I think that it's something that's just very important, especially with value-based care medicine. One of the metrics that they look at is for patients to get mammograms. And so our primary care doctors focus on every time a patient comes in, have you had your mammogram for the year? And it's something that is very important. Preventative care is the best, way we can handle ourselves.
Right. So do you think that when it comes to breast health, when it comes to preventive medicine, when it comes to what a woman could do for herself, we don't use shoulds here. What do you think CLS is doing that's making it more comprehensive, making it more accessible to women?
That's a good question. I think that they are ensuring that the patients around Houston, where we are, because we're not in Webster anymore, we're everywhere. We have 37 locations all over Houston, that they know where their resources are and that they know where they can go to get care. And
many of your doctors are very involved in the community.
They are, very.
Yes, I think that is one of the distinctions, so that patients aren't just seeing them behind the white jacket. They are seeing them as people, part of the community, caring.
Well, and when we hire doctors for certain locations, we really want them to live in the locations where they are practicing. So if we go into the Heights, we like our doctors to live in the Heights or somewhere close to it so they can take part in the community where they are seen, where their kids go to school, where they go to the grocery store, where they become, a part of that community and they're not just there to work and take a paycheck.
So almost every specialty is offered.
It is.
Right. So after being in this world for so long, I continue to be amazed that women either don't know the importance of mammography, don't know how to access it, or are just too afraid to go and have a mammogram. And have you found that in what you've been doing as a CEO or as a friend?
Absolutely. In fact, about 2 weeks ago, I had a conversation with a girlfriend of mine who said, I'm not going to get a mammogram. It may hurt. And I said, okay, let's have a conversation about this. Because every year on my birthday, I give myself, I make my appointment for my mammogram. That's my gift to myself. And it is because I had an aunt who had breast cancer. My mom's best friend, who was like a second mother to me, had breast cancer. And it's something that is just so unbelievably important to do for yourself.
Right.
And so when I hear that, it still shocks me that today people don't want to go out and do preventative care. I mean, knowledge is so unbelievably important. It's the only way we can take care of ourselves.
And the other part of all that is we didn't always have this privilege. We may not always have it. I mean, think about the changes in mammography and women's health.
Right.
It really is. So what did you say to her exactly?
Well, I sat her down. I said, okay, we're going to need to have a conversation. Why do you think it's going to hurt? And she said, well, my mom told me, back when she used to get them, they hurt. And I said, okay. As you know, anywhere on television these days, technology has changed. It does not hurt at all. You need to go in. You need to get and I made her make her appointment right then. And
Whoa.
I said, we're going to sit down right now and you're going to schedule your appointment and you're not going to cancel it. And so she has it next week. So I'm going to double check with her to make sure that she goes.
Are you going with her?
No, but I will if she wants me to.
Well, I mean, that's sometimes the only way you can get a friend in.
Yeah.
By saying, I'll meet you there. I'm going to sit in the waiting room till you get through. And
after
we go
this,
have
I might
something
call her and
fun.
tell her. Yes, I may be going with her.
The other thing that I've found over and over is being a caretaker just pulls so much out of someone. It's like not only are you having to take care of yourself, but yourself always gets pushed back when you're taking care of someone else. Now, you've known that role. Do you want to share with us some of that?
Sure. It's a little raw because it's been recent. But I'd start with my dad. When my dad had cancer, my mom and I were his caregivers. And we went to every appointment with him, sat through every chemo treatment, and I watched my mom over it was a several-year process, and luckily he is in remission still. But I watched her do everything she could to still take care of him and try to take care of herself. And when my husband got sick early last year, I leaned on her a lot to try to figure out how do I balance being a mother, working the job that I'm in, taking care of my husband, and making sure that I keep myself healthy in order to support everyone that I was, having to deal with. And it's difficult because you want to ensure that your spouse or a parent, it might be, but in my case, it was my spouse, that he was, comfortable whenever he was ill. But even whenever he's sleeping and you think, okay, I'm going to get rest, then you think, oh, I have to do the laundry. I have to, take care of the house. I need to check on the kids. And your health can start to decline as well. And so it's a fine line of how to take care of them physically and take care of yourself. And then there's the mental aspect of it is, what happens if something unfortunate happens or if your spouse doesn't make it, and then what happens if they do and it's a different type of lifestyle, or what, there's so many different what ifs whenever you're a caregiver that it's hard to get through it without, some sort of lasting kind of mental, dealings that you have. And that's, my husband passed away 5 months ago. And so it was,
I'm so sorry. That's okay.
This is the raw part that's not always fun.
Mm-hmm. No, anytime you're going to talk about it, it's going to be like going through it again.
Sorry. Go ahead.
You said being a mother. How old are your children?
So we had 4 boys together. Mm-hmm. They are 28, 26, 21, and 19.
Wow.
Yeah, my husband actually passed away on our son Sam's 21st birthday. Yes, and he got to see him that morning, and then he passed away later that day. And my husband was a phenomenal human, phenomenal father, and taught our kids a lot, and taught me a lot too. And so we live with that every single day. Mm-hmm. We push forward. He used to wake all the kids up. No one was allowed to sleep past 7:30. And, he'd say, get up and get your day started. And so that's what we still say to each other every day. And, we move forward. But the boys are more, it's funny now, if they have any sort of ailment, they're like, I need to go to the doctor and get checked.
Oh, really?
So I think they were caregivers also. They had to see it, in different levels. And that's one thing that I think people forget is the kids actually see their parents dwindling or their spouses dwindling down whenever they are ill, and it takes a toll on them also. Mm-hmm. So it's a family affair. Whenever you're a caregiver, it's not just one person; it's the entire family.
Right. Mm-hmm. And every disease is a family disease, no matter what you're going through.
It is.
I'm so amazed at how many children, and really these are very young adults, but have had to face this at some point in their life. Mm-hmm. As we see more younger people developing different types of diseases, it's we just don't have the tools. We don't have the coping tools for it yet, and especially the young adults. How did you really handle them? Did you just innately know what to do? Did you go outside for some help with them, or
with
your children?
With my children, we stay. We're very close knit, and so we stay in touch with each other a lot. Every day we talk, and
still,
absolutely, yes. In fact, it's something that we have made a concerted effort to ensure that we're talking with each other every day. How are you doing? And some days are worse than others. And the question that you hate, I think, when anyone passes is, "How are you doing?" Yes. So we try to find different ways to ask that, but we've all been in the same boat. We've lost the same human who was very important to us.
What other ways do you ask that?
We may just say, like, how was your day? Is there anything that kind of, that you want to focus on today? Something like that, where it's not just, those words.
Right.
I think, too, when a lot of people say, oh, you've handled this so well, you've been so strong, I think you're just in survival mode. Mm-hmm. And you just get through it. And I couldn't have probably done this without the support of my family at CLS also. Mm-hmm. I have an amazing support system at home with my family, my close friends, our neighbors. Everyone has really just stepped in. But my work family also has been just absolutely amazing.
And that could really, really make or break you.
It could. And several of the doctors at CLS took care of my husband. They still check on me, and it's another form of family that I think is really important for, people who work. I spend more time at work than I probably do at home these days, and even before my husband passed. Work is where it's a separate family.
It is a separate family.
Yeah.
And did you have any? Of course, you had doctors there caring for him, but did you find yourself saying, "I need some time," or did you have to stand up for yourself, even though you had total cooperation? Did you find yourself having to do that?
I took a couple weeks, but I've eased back in. But the Dr. Bob and Dr. Dwake and the entire CLS staff, they've been very good about letting me work. Work is what kind of brings me back to my center,
right?
Also, and so I probably came back sooner than I should have, but it brought some normalcy to my life, and that was something that I think I needed. I think the boys needed to see that we do have to get up and move on, which is tough, but you have to stay, active and keep doing what you're doing.
And having those routines.
Yes, it's very important.
Yes, some kind of structure when we feel like the ground has moved beneath our feet. Yes.
And anyone who knows me, has worked with me, knows I'm very structured. So we had to get back to that for sure.
Yeah. So how do you help other women get through something like what you've gone through?
It's interesting. There are several women in my community who we've all lost our husbands around the same time in the last couple of years.
Really?
And we meet for dinner, we talk, we check on each other regularly. We let each other rant whenever we've had a bad day. We cry with each other when needed. We support each other, check on each other's kids. I think it's important to have a community who has seen what you've been through, has been through it, maybe in different aspects. People pass away for different reasons, but it's the it's the beauty of a community that I think is so important.
And we're hearing so much about that. People often need to just realize that you can find these communities even if they're not right there. There are communities online. There are so many different ways, but it starts with being able to reach out.
Yes.
And that's hard.
It is.
Yeah.
It is.
You have a persona of, hey, I'm in charge here and, I'm going to take care of everything.
Yes.
But sometimes we need to remember we need to have someone taking care of us.
And that's been a challenge for me, is to be able to say, I need to step away for a minute and, just kind of take a breather. I've always worked since I was 15 years old. That's something my parents instilled in me. You work hard. I had a very, all the women in my life and my family are very strong women. And they've all held different types of positions or different jobs, but they've always, worked hard. And they instilled that in me. And I came from a family business where you work, if you're at work and you're not working, you're stealing.
Yeah, right.
And so they, I think that's been helpful for me to, have that type of upbringing to be strong and to be in, what I am right now as the CEO of CLS. It is a man's world.
All right. How do you navigate that? Come on now.
No, that's a good question. It's one that I like, actually. Like I said, I was raised with a lot of really strong women, but I learned at an early age. It was my first job, and I was in Longview, Texas, working at a TV company, or a radio company, I'm sorry, selling radio advertising. And my first day, I'm this bubbly little girl that just graduated college, never had a real job. I'd had other jobs, but I walk in and I had these accounts that were given to me, and this man just walked into our meeting and said, "No, I'm going to take those accounts from you. I've been here longer." And I said, "Well, these are mine. I'm trying to be nice." And he said, "No, they're mine now, sweetie." And he walked out. And I called my grandfather and I said, "Papa, you will not believe what just happened. It's my first day. I got these accounts and this man said, 'These are mine, sweetie.'" And he walked out and he said, "Megan, you are a legio." That's my maiden name. "You go back in there." He said, "Because if you don't fight for yourself now, you will be run over the rest of your life as a woman. So you walk in there and you tell them those are your accounts and you are taking them back, and you stand your ground, or you might as well pack up your stuff and go home."
Wow.
And I said, "Well, how do I do that?" He goes, "You need to figure it out." And so I walked in and I did. I said exactly what he told me to say. And the guy just kind of smiled and said, "Well, you passed your first test."
Oh my goodness, really?
Yes. And it was a turning point for me, a very early age, to learn that I had to stand up for myself where you can get run over. And I think men and women both. It just depends on, you can stand up for yourself without being disrespectful or rude or to come across as arrogant, but you have to stand up for what you believe in. And I think particularly for women in, different industries, it's sometimes hard to do that where you feel like you might be stepping on people's toes, but you have to be, you have to be confident, but you also have to know your industry. You have to be knowledgeable in what you're doing, or you can get caught in a different situation also.
Absolutely. Mm-hmm. So now you have all boys, right?
I do.
So how have you groomed them for working in this kind of world with women right by their side?
So I love watching my boys with their girlfriends, or my oldest is married. They're all very sweet with their wives. They all, but they let their wives, be themselves also, which I love to see. But I'm happy to see that they all date girls too who are very confident, who will stand their ground, who a couple of them are teachers, and then a couple of them are still in college. But I always want to watch and make comments to the boys here and there about how to be a respectful husband as they grow older. Mm-hmm. And I think it's good to see, they got to see how my husband treated me. They open the doors for their wives and girlfriends. They take good care of them, but they let them be themselves too, which is good.
Mm-hmm. And your husband was very supportive of you working?
He loved it, yes.
And you worked very hard during that time, I know. Yeah. Uh-huh. So how did you juggle just trying to have time for him?
We were very good about making time for each other. Once a week, we would have dinner, just the two of us, and sit down and just kind of reconnect. And in the mornings, we always would get up early and talk about our day. What do you have going on today? What do you have? What does the evening look like? Because he ran his own business also, a construction company, which I'm actually running as well right now with his passing. So just something else to to put on my plate.
And wait a minute, Megan. Mm-hmm. You go from being in a very high-level, different kind of world in healthcare to construction?
Yes.
Yes. How do you mentally do that?
That's actually a little bit of a release for me. I really enjoy construction, and even through all of the different places in healthcare that I've worked, the construction piece is always rolled up under me. So I've known enough to probably be dangerous, but not enough to, do it as a full-time job. But we have a great staff there. My husband had just phenomenal employees who've been with us a long time. So they're helping me through that. But it is, it's exciting to do that as well. And one of our sons, Caden, works there. So he and I get to talk every day now on a work,
level.
Instead of just mom and son, which is nice.
And what do you build?
So it's general construction on more on the commercial side. Uh-huh. Yeah, so surgery centers, dental offices. We do a lot down the Port of Houston. So it's exciting.
Do you actually change your attire when you go into that?
I have a hot pink hard hat that's in my car and some boots that I keep in the back just in case.
Oh, yeah. That is so neat. And it gives you some variety, too.
It does, yeah. And I feel close to Cody still, being able to, help with his legacy for his boys, which is good.
Yeah.
Yeah.
Yeah. So in healthcare, let's go back to your job for just a minute. What do you think is the most important thing that we can do in our systems right now?
I think access to healthcare.
And what does that mean? We say that all the time.
I know.
But what does it really mean?
I think it's ensuring that we are available in all of the different communities around Houston, not just your big cities, but the communities around, and having access for these patients to be able to come in and get good quality care. Mm-hmm. I think there's places that they can go and the quality may not be up to par, and they may not care enough about the patient to ask each of the questions that they need to ask. That's one thing that value-based care does bring to the table. Mm-hmm. It's ensuring that the patient is taking prevention seriously. Mm-hmm. But that's something that CLS really is striving for, is to ensure that we get into every corner of the city.
Right. Mm-hmm. And I think that geography is very important, but it's also that community-minded aspect of any kind of healthcare. I know with our mobile unit, 70% of the women will tell us they wouldn't have had their mammogram, except we were right there. And I think, really? But it is that you're right there. It takes 15 minutes. You're not having to leave. All of the things that we as women put off doing just because, but also because we have a lot of other pressures. So geography and also attitude.
Mm-hmm.
Give me any other examples of access to care.
Well, those are two big ones, of course. I think it's the type of specialties that we're putting in these different markets also. We do a lot of analysis on what type of doctors to put in different areas. If there's an area that has a ton of podiatrists, well, we're not going to put one there. But if there's a need for rheumatology or endocrinology, of course, primary care, cardiology, we're looking to see what the community needs. And not just putting someone out there because, we need to hire someone.
So that's part of your community assessment.
Absolutely.
as you're going through.
Yeah.
And hospitals have to do this all the time. But sometimes I wonder if they're really taking a look or if they're following their own agenda and saying, well, this is what we meant to do. And here we have this assessment that's supporting it. It's like, really? Because we are asked many times to be that community partner, especially during that time.
Yeah.
And I think, come on, folks, this is not a true community assessment. So how do you think insurance plays into all that?
Oh, that's the big piece. Insurance makes everything a little bit more difficult these days. But it's not, we at CLS, we take just about any type of insurance that there is, and we push to ensure that we partner with every insurance company that there is. But, sometimes they make it more difficult for the patients.
Well,
to get
when you
care
have to get an authorization.
for everything.
For everything. And last year you didn't. And then if you show up and you're turned away because you don't have that.
Yes.
Yeah, that has created
does.
huge barriers.
It makes taking care of our patients so much more difficult. It shouldn't be that hard.
And do you offer cash programs?
Yes.
And a lot of places will not do that.
Yeah. But even going back to the hospital comment you made earlier, that one thing about being provider-owned and provider-driven is that we do not partner directly with any hospital system in Houston. We partner with all of them. So we meet with our hospital affiliates regularly to see what their needs are. And then when they do give us what they are, we go and assess them and make sure that it fits what we see for the communities also.
But that's good.
Yeah.
So you're not tied into anyone. Yes. So what else would you want us to know about you or healthcare or CLS?
I think more than anything, this is a time, in the world where we need to take care of each other, ensure that we have the right resources to do so, partner with the right people who truly have the same mindset, taking care of our patients across the community that we live in, ensure that our communities are safe, and that we are doing everything we can to just be better humans.
That's so true. That is so true.
Yeah.
And I think somehow or another, COVID interrupted that way of thinking. And I think we're having to make an extra effort right now.
I would agree with that.
In so many ways. And when you talked about being safe, that really is the base of all of it. Am I safe here? Do I feel seen here? Do I feel heard? And so it's so good to know that CLS has really embraced that and that your patients do feel that way. I certainly do.
That's good.
I love my doctors there. Yeah.
That's good to hear. That's why I love to be a part of it. That's why I came out of my 6 weeks of retirement.
A whole 6 weeks now,
a whole
Megan.
6 weeks,
wow.
yes.
All right. Well, thank you again for being on our show.
Absolutely.
And we'll look forward to having you back.
Thank you.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.